Well, thank you so much, everyone, for being here. You'll forgive me. I have a few thank yous to make. This has been several years and many hours of toil in the making. So I first want to thank the National Rehabilitation Center in Abu Dhabi. Doctors Hamad and Shamil have been supportive of the technology transfer centers for several years and have been a great champion for us. And we're so appreciative for them hosting this event for us today. Thank you to the U.S. Department of State and INL, especially Brian and Charlotte, for all of your support in making the ITTC a reality. I want to thank Columba Plan and Natalie and her team for being excellent collaborators and really inspiring us. Of course, thank you to Kim and also Carrie at ICU DDR. Kim and I have worked together for many years on many different projects, and it's just wonderful to get to work closely together once again and build this network. I want to thank the leadership of the ITTC network. You'll be hearing from a few of them today, but I want to thank all of them, some of whom you will not hear from today. Igor and Arena from the Ukraine ITTC, Zhang and Zung from the Vietnam ITTC, Goodman and Dan from the South Africa team. And then I want to thank my colleagues in the US have really helped us build this network. Sherry, Gavin, Sarah, and Caroline, their experience and expertise in working in technology transfer across the globe has really been an important aspect of our work in the ITTCs. And then, of course, I want to thank my team, Cindy, Aaron, Eric, Amy, Alex, Molly, Holly, and all of the team at University of Missouri Kansas City Collaborative to Advance Health Services. It's been a group effort. Many are on the meeting today. And I'm really proud to be part of such an excellent group of colleagues. And lastly, I just want to thank our two interpreters. I know we had a little bumpy start in getting the interpretation active. I hope it's working well now, and thank you for being here. Okay, I think I will skip over some of my slides because Dr. Fixon already explained a lot of what it is that our goal as ITTCs is to do. So the key points I'll talk about is that ITTCs are universities or research institute-based centers, and that we are a branch of the International Consortium for Universities for Drug Demand Reduction. That our goal in doing technology transfer is to accelerate the diffusion of innovations, and that we do this by employing a systems thinking approach, so looking at things from a holistic systems level, and then building capacity across multiple levels. We have already launched ITTCs in South Africa, Ukraine, and Vietnam, and we are launching more in the very near future. So as I mentioned, International Technology Transfer Center, what is it? Technology transfer is can be a little bit of a jargony term, and it can be confusing because technology in common language often means computers or mobile phones. But when we talk about technology, we're talking about science and what is the research that tells us and drives us for quality, effective substance use prevention, treatment, and recovery services. And transfer is then getting that research, that knowledge that has been evaluated and tested into the hands of people who are going to use it to improve the health of our communities. So an ITTC, or an International Technology Transfer Center, is based in a university, and our job is then to do technology transfer, to use the tools that Dr. Fixon just really described better than I ever could hope to, and improve substance use prevention, treatment, and recovery across the globe. Why are we based in universities or research institutes? The reason is that in many countries, universities have been around for quite a long time. Administrations may change, governments may change, but a university tends to stay regardless of if that change happens at the governmental level. There is a wealth of subject matter expertise in a university or research institute. So faculty who have studied the research, who have the knowledge to be able to impart to practitioners in the field. Many times universities are seen as neutral conveners. So they're not affiliated in many cases with a particular political party or a particular ideology. They are neutral and then can serve to bring together people. So ITTCs are often play the role of conveners, bringing together the right stakeholders around the table to discuss and plan and strategize for improving substance use prevention, treatment, and recovery. And we really feel like building ITTCs in the universities provides sustainability over time. As I said, sometimes community-based organizations may come and go, government administrations may come and go, but if we can embed the ITTC in a university or a research institute, then we hope that that will ensure that we stick around for a long time in the future. As was mentioned, ITTCs are a branch of the International Consortium of Universities for Drug Demand Reduction. And I just wanted to talk a little bit about how that works. ICUDDR here in the yellow rectangle, if you're looking at the screen, is the parent organization. ICUDDR has several coordinating centers and 3 main branches. One branch works on building the capacity of academic programs. One works on developing research portfolios internationally. And then this 3rd branch will be the ITTCs. So really providing implementation support for provider organizations to improve the work that they do with their clients. It's important to note that the ITTCs are a new initiative, but they're not coming out of the blue. We have technology transfer centers, TTCs, in the US. So we have 3 TTC networks in the US, 39 technology transfer centers all together. And I like to say the mother of all of the technology transfer centers is the Addiction Technology Transfer Center Network. The ATTCs have been around now for almost 30 years. And so the good news about that is that ITTCs will be connected through the ITTC Network Coordinating Office to these US-based centers and have access to all of the resources and staff and knowledge and competency and expertise that we have built in the US. And then for those of us in the US who are part of those networks, it's a real advantage to us to learn from others who are doing this work in different parts of the globe and who can bring new perspectives to our work and help us continue to innovate and improve in our country. So it's a really exciting opportunity for bilateral communication and collaboration across the globe. Why are ITTCs needed? So you may be familiar with other international networks that are focused on improving or enhancing substance use prevention, treatment, and recovery services. I believe our colleague from the International Society of Substance Use Professionals is on the webinar today, ISSUP. And if you aren't a member of ISUP, then please go to the ISUP website. Maybe someone could put it in the chat for me and become a member. They're a great collaborator with us. Also have a lot of complementary activities to what ITTCs will be doing. So why are ITTCs needed? We have, we talked about Colombo Plan and the universal curriculum. We talked about, we mentioned some other initiatives across the globe before. ITTCs are going to be focusing on that intensive technical assistance that we just heard about, the implementation. So there are many places, and I saw some questions in the chat about expensive training and different kinds of training initiatives. And training is critical. We have to develop the workforce. We have to have a competent workforce, 100%. But we do know that training alone is never enough. And so we need to think about what are the other strategies that we can take when we work with organizations and systems to be able to help those groups implement with fidelity interventions and then be able to sustain that implementation over time. This image you see here is how we illustrate what technology transfer is. And I'll explain it very quickly. It's really, imagine yourself in an airplane and you're looking down on the landscape and you're seeing maybe a big picture view of how we think of the continuum of the diffusion of an innovation. So it's a very high level view of that continuum. An innovation starts perhaps in development. Researchers develop a protocol and initially evaluate the intervention to demonstrate its effectiveness. And then the elements, the essential elements of that innovation are distilled and packaged, or as we say, translated into terms that are usable in the field. So taking the journal article and creating checklists or curriculum, websites, and other kinds of tools that can actually be used to explain what the essential elements are and used in the field. And then the intervention is disseminated. We raise awareness about the intervention. So this has a lot to do with that universal technical assistance that Dr. Fixon talked about. Doing training, webinars, marketing, letting people know that the intervention exists. And then once an organization knows about an intervention, we can work with them to help them try it on. Is this the right fit? And we call that the adoption process. So pilot testing. Does this work? If we use it here, what kind of testing, what are we going to have to do to change our organizational culture, our organizational practices? What additional training are we going to need? What kind of people are we going to have to hire? That kind of thing. Sometimes during that process, an organization or a system may realize this isn't the right practice for our setting and decide not to adopt. But many times they will move into implementation, which really leads to incorporating the intervention into practice with fidelity over time. So again, that's a very high level view. We do have that those arrows that go through that, because what I just described is very simplistic. And what we know is it's never that perfect in the real world, and it's an iterative process. And ideally, practice informs research just as much as research informs practice. And then technology transfer is an overlay over the graphic, because we talk about technology transfer being those intentional strategies that accelerate the diffusion of an innovation. And so ITTCs are needed because if you have an effective intervention, but you have ineffective or insufficient implementation, then you will have poor outcomes. And it's not the fault of the intervention per se, it's the fault of the implementation. And so what can happen then is you hear things like, someone went to, Dr. Fixon mentioned motivational interviewing. Someone went to a motivational 3-day motivational interviewing training, came back, tried to use it in their practice, didn't go so well. And so they blame the intervention. They say, oh, that motivational interviewing, that doesn't work. Well, it's not really that the motivational interviewing doesn't work. It's that the way that it was implemented wasn't effective. So technology transfer is the process of accelerating the diffusion of what is known to what is done. I talked a little bit about this, and I am going to provide these slides afterwards. They'll be available on the ittcnetwork.org website. So I'm not going to go through them all today. I think, as I said, we heard really a great explanation from Dr. Fixon about the kind of work that ITTCs will do. We develop capacity across multiple levels, individuals, organizations, networks of organizations, and systems. So while some groups may focus on individuals only, other groups may only focus on systems, we're really looking across levels at how we can influence all these different groups. The kinds of capacities we're developing are not only the technical capacities of prevention, treatment, and recovery science, but also looking at operational capacities, systemic capacities, and hopefully getting towards adaptive and influencing capacities that people can sustain their use of evidence-based practices despite fluctuations in their environment, despite, as I mentioned before, changes in government or different policies. You can figure out how to adapt to the environment and continue to use the best practice. And so how do we do that? That is what Dr. Fixon just talked about, all of the different levels of technical assistance. So I am going to skip through those since we just heard about it, and hand it over to my friend and colleague, Dr. Goodman Sabeko, to talk about the South Africa ITTC.
Thank you, Laurie. Yeah, so I'm gonna have to speed it up a little bit. So I'm gonna try and see how quickly I can get through it. So as Laurie's mentioned, the ITTCs are based within the universities within the country, and ours is based at University of Cape Town. That allows us to leverage the expertise of our colleagues that you see on the screen. Fergus Ashburner is our course convener for the Postgraduate Diploma of Addictions Care, and assisted by Shahima Ali. And Nurain Sisika comes with vast experience in managing treatment centers and in providing care for dual diagnosis in the private sector. Dan Stein is, of course, a world-renowned researcher and has led many and participated in many high-level research projects around the world with many international collaborators. And I come in as the director of the ITTC. So next slide, thanks, Laurie. So how, in order to assist us in meeting our mandate as ITTC, we've assembled a group of advisory board members with a national footprint and whose expertise and activities in the country align with the drug demand reduction goals of the ITTC. Most importantly to mention is that we have on our advisory board the Director General for Health, the National Department of Health, Dr. Sandile Buthelezi, as well as the Central Drug Authority, who are the custodians really of the National Drug Master Plan, which is really the policy playbook for the rollout of drug demand reduction in South Africa. And you'll also see representation from provincial partners, both from social development, who are really the seat of substance use treatment in South Africa, as well as Department of Health, who obviously have to then provide the health aspect of addictions treatment. You'll see that we have partnership with World Health Organization as well, through the participation of Dr. Msimang Radebe, as well as other sort of national partners who I can't go through right now. So next slide, thanks, Laurie. So our aims really are to support the development, dissemination, and review through those iterative processes that were described so aptly by Dr. Fixon. What an amazing talk. In really looking at how do we take the policy forward, and in being responsive. Dr. Fixon talked about changing your TA. How we change our TA is by engaging with our advisory board and engaging with the partners that come to us for technical assistance. And part of that work for us involves the SBIRT policy framework, which we're working with national government and other partners in the provinces. So our aim is to provide ongoing input into that policy framework, amongst other policy pieces, and provide ongoing technical assistance and training in that SBIRT rollout. And of course, we're part of the OST guideline development process and implementation plan review. In furthering these efforts, we also have capacitation activities through which we partner fairly closely with Colombo Plan Drug Advisory Program. And we're happy to increase our collaboration with ISAP South Africa and Global, as well as ICDDR. And these are just some of the core trainings that we offer, that's MI and SBIRT. And we have other activities, including the upcoming Addiction 2021 conference, which we're planning in consultation with ICDDR. I'll throw the URL in the chat in a moment so that everyone can take a look and see how you might participate or assist us as we move forward. We've got other exciting provincial projects, including the Provincial Center of Excellence in KwaZulu-Natal, which we're hoping is really going to be a litmus for how do you incorporate high-level training and experiential exposure for practitioners in furthering training in drug demand reduction. So that's just a snapshot of some of the work we're doing. In order to take that forward, we are going to be working closely with the ITTC network and with our funder in developing a needs assessment and a review of service availability and need, and then we'll take it from there, and we'll tweak and adapt our TA to be responsive to the needs of the policymakers and the providers on the ground. So that was a real speed date, and I hope you were able to get the gist of it. Looking forward to the other speakers. Thank you.
Thank you. Next, Dr. Irina Pinchuk from the Ukraine ITTC.
Thank you, Laurie. Good morning, good afternoon, good evening, everyone. It is a pleasure to me to be here and present the Ukrainian International Technology Transfer Center. The Ukrainian ITTC is hosted in the Institute of Psychiatry in the Taras Shevchenko University in Kiev, and it collaborates with the University of California, San Diego. Next slide, please, Laurie. Our team consists of Professor Igor Kutsinok from University of California, San Diego. Professor Kutsinok is director ITTC project. I am a country director ITTC, and Yulia Yachnik, she works at the liaison office here, ITTC project. Next slide, please. We want our work to be in line with national priorities, so we formed the advisory board to support the ITTC Ukraine. All advisory board members are invited to the ITTC launch today, and we plan to discuss our prospect together today. The advisory board includes representatives of national and international organizations, governmental agencies, university. Next slide, please. In Ukraine, there are a lot of different addiction treatment resources, which vary on their quality and availability. Therefore, one of our first activity would be to map the existing services and identify existing needs. Our priority is improvement of quality of care in accordance with existing evidence and with human rights perspective. Therefore, we are focused on repeat implementation of the international standards of treatment across the country. And for this purpose, we plan to introduce the UNODC quality assurance tools. Additionally, we plan to introduction of the international standards of prevention. From a strategic perspective, we are looking through several directions to focus. Veterans, criminal justice, psychiatrists and medical workers, mobile community mental health teams who work with dual disorders, and community addiction treatment services. We plan increase the knowledge and skill in recovery-oriented approach. And within the university, we plan to collaborate with other universities, representatives to foster change in addiction psychiatry curriculum. We are focused on closer integration with ISAP, ICUEDDR, and other major organizations. And one of the future possibilities will be expansion of our training initiatives to other Russian-speaking countries. The Ukraine ITTC offer a different menu of innovative and flexible program to put research into practice. Some of our most popular program include a detective workshop, conference, webinars, supervision. We also would develop collaborative relationship with providers and organizations in the treatment, criminal justice, medical education, and recovery communities. We are open to cooperation. Thank you for your attention. It is a pleasure to be a part of this nice family ITTC network. Thank you.
Thank you so much, Irina. And now, Dr. Zhang.
Good morning, good evening, good afternoon, good night. No, not good night yet. So it's my pleasure to represent our colleagues from Vietnam and really to be part of this distinguished panel with my very close colleagues from all around the world. I would like first to thank all of the participants from all over the world. Now more than 200 participants, and many of them from I know that now staying late at night to attend this excellent launch event. I also want to thank the INL Colombo Plan and ICUEDDR for choosing Vietnam, and especially our group at the universities to develop the ITTC in Vietnam. This is an excellent opportunity for us, not only for the university, but also for the country. And last but not least, I want to thank Laurie and her group at the ITTC headquarters at the UMKC for supporting us all the way and really for this excellent launch event. So the Vietnam ITTC this is our first year of activity, and we consider this as a preparation period, and we at Hanoi Medical University is very honored to be the prime awardee of this project. And for this phase, for this year, our goal is to build a foundation for the development of Vietnam ITTC. And what I mean by foundation is that we build the advisory group. We build a network of trainers, the national trainers, a network of trainees, and most importantly is the work plan for the period from 2021 to 2025. Next, please. So Vietnam ITTC is a collaboration of 3 long-term partners. We 3 universities, 2 in the north of Vietnam and 1 in the southern Vietnam. We have been collaborating over the past 6-7 years on many activities to build the capacity for addiction treatment in the country. And 2 of the universities in the medical sectors and 1 in the social affairs sectors. And you could see the name of the university here. And most recently, we have established a distinguished advisory board that is composed of 22 members representing the Office of Government, the health sector, the social affairs sector, the civil society, and international organizations that are active in Vietnam. So we're very proud of our advisory group, and we are very thankful for the members who have given us time and effort and their wisdom. We just held the first meeting in January, and we got a lot of advice and inputs from the advisory members for our work plan in the next few years. Next, please. So in the next few years, this is some of the outcomes from the first meeting of the advisory. We would focus on 3 main. We have 3 main objectives. The first one is to develop the quality workforce. That's what we have been very active in the past few years. But now we would focus more not only just on treatment, but also on prevention, on screening, and especially the recovery support services. So that's the first area we will focus on. The second area that we will start to work more intensively is to develop the models for integrated services. And here what I mean is the services that integrate both the health and social services, but also services that are integrated in the main stream systems, whether health or social service system in the country. And we hope that in these models, we will bring in the evidence-based practice. And this is the third step in the implementation stages that Dr. Phikson presented earlier with the pilot implementation. The third area that we will focus on is to support the development of policies and technical guidelines that build on the evidence generated in the world, but also in Vietnam. This is because addiction prevention, treatment, and recovery are very new in Vietnam. So this is the area that we will focus on strongly the next few years to support the government, but also the sectors in the country. To complete these objectives, we have a few activities listed here, but I want to highlight the importance of networking. I think that it's very important for us to be part of the larger network of ITTC, but also the larger global efforts supported by NL, ISUP, ICUDDR, and other partners in the world. So we are very pleased to be here today, and thank you very much for your attention and for your attending the launch. Thank you.